Hi, I'm Dennis Niyomugisha, uh, graduate student in Carnegie Mellon University. I believe that at least once in our lifetimes, we face these challenges I'm going to list. While approaching a physician and you've lost your uh, insurance card, you will have to pay the full cost. It's a problem. If the physician thinks, even though you have your insurance card, the company, your insurance company, is not able, or the physician is not sure really if the company will pay the full cost for that service because the service might be expensive, they will have to send you to your insurance office and they stamp and approve your documents for that specific service. Maybe buying glasses or what. Okay, that's regarding insurance company and the hospitals. Another thing that usually happens, and oh no, can even say it always happens because that's how our systems are. If you go to a hospital X, after another week you go to another hospital Y, you will not find your data. And if physician will start from scratch, sometimes they take redundant tests, yet the previous physician had taken the same tests. You have to pay more money. So I'm proposing a solution here, which is a software which is now interconnecting all of those healthcare stakeholders from the patients up to the Ministry of Health via hospitals, pharmacies, insurance companies, and many others, where they have a single platform of uh, uh, of interaction. It means the physician will not need to call the company, or they will not need to send the patient to the insurance office, but they just get the data they need from this software that we are proposing. The patient, if they go to another doctor, they will find their data. Isn't that good? So let us see how this application or solution is working. We are having a prototype. Okay, these are the two screens. This is for okay. This is for uh, the patient, and this is for the doctor. The second one, this second one is for the doctor. Okay, the cursors are not switching. So this is for the patient, and the other one, and on the other side, is for the doctor. So let us try to see what a doctor can do. A doctor can log in. We have a doctor called Dado. The password, the login. So as a next layer of authentication, we use a fingerprint, so you can't hack easily. No one can hack easily. So if they can do some they can do some stuff on medical records of the patient. They can check the patient's history and they can log out. So what happens if they try to check patient? You see, it's not working because there is no patient who gave them the access to their data. So let us try to go to the patient part, I mean site, and see what a patient can do. A patient can log in. A patient can log. We have a patient called Wino. Wino. So you see this is a patient. Again, the fingerprint. So if the patient, so you see the patient can grant access to the doctor, could check consultation, update that status, healthcare and pharmacies. So let us try to grant access to the doctor, because the doctor has been trying to access patient data, but they can't because this system makes sure that the data of the patient is the privacy is preserved. So now we have to provide here the ID of the doctor. We have the ID for the doctor, which is 52 doc. 2017. I know it by head. So if I give them register this permission, but it's only temporary, it can't last. So you see, now they're able to get to the new step. So now this is like all activities that the patient, that the physician can perform on behalf of this patient. They can add consultation. Let us add a disease like cholera. I'm sorry for this terrible disease. Okay. So if you go back to the patient, you're going to see if really on his history, cholera is already there. We are going to go back a bit. Okay. Okay, go back. We are going to check consultations here. You see, the very last one, the current one now is cholera. You see, this is cholera. It's already there. So this is what the doctor was able to do. They can even do something like add drug prescription. It is here. So you see, you can add a drug prescription, but you only add drug prescription which are already in the system. And because we don't have a screen for the pharmacy, we are not able to add some medicines and retrieve them. So what we're going to do, we're going to keep looking at what a patient can do. So these steps that the doctor has taken are the same steps as what if a pharmacist can do. Let us try to see if we can log in as a pharmacist. Pharmacist. Try to see if I remember some. Patel. See if I remember one of the pharmacists. Again, this guy does not exist. Let us register pharmacist. Pharmacist. Register as a pharmacist. I put a name of race. No, this is the ID. Race. Race. Okay, race. Register. Okay, even if there is no confirmation, the guy might be there. Race and race. Okay. Now, this is a pharmacist. For the pharmacist, we didn't put their fingerprint. So a pharmacist still can check the patient, but they don't have the permission to. They can register medicine. Now they don't need to ask for permission to register medicine. So I don't have some. I have something here which has a barcode. Let us do an experiment. So when we say scan drug, we take the barcode. Okay, the computer screen is not reflecting what is happening, so we decide to leave it because it doesn't make sense and it is not important if on the screen the reader can see it. So let me go back to my patient. So okay, we are done with the pharmacist and the physician. So what else can a patient do? A patient again, this work and what they can do, they can update the heart status. Updating heart status has more features. You can do your BMI, check your BMI, check your heartbeat rate, check your temperature, locate healthcare centers or pharmacies. So let us do two of them. Let us update, check our heartbeat rate. So this is the next screen. The next screen. You are supposed, you see, it's a camera. So you have to put your finger there on the camera. You see. So it has recorded 41. Is it right? Let me record again. So it is just recording 41. So if I go to save, it will just save that one. So if we go back, we can locate the healthcare centers or pharmacies. Oh no, the previous screen. Healthcare and pharmacies here. I think you see the next screen. It's just, they give you the districts, Bugesera, Kicukiro, Nyarugenge. Those are the 3 districts you took for just this prototype. And you have on, if you choose Bugesera, you have this list of health center, Centre de Santé, which are there. Let us take like Ruhuha and locate. We shall choose, okay, on the screen, something is not going well. They are not able to show us. Okay, the computer screen has frozen, but on the phone. So what happens here? We just locate this Centro do Sante on the map and be able to navigate using the voice. So all of these features are really helpful to the patient. The patient is benefiting from this service by having their data decentralized. They can find their data anywhere. They can get features like this, where they can locate any health center or pharmacy or any other facility in their neighborhood. Moreover, they can update they do some self-diagnosis, the simple one, heartbeat, temperature, and so on and so on. So you see, this is really a good service or a good application to the patient. Another thing is that both pharmacies and hospitals and insurance companies are benefiting from that integration, that just interconnection of mm, of them. They will no longer now be working remotely to one another, and to really be beneficial to any one of them. Another, last but not least, is just the fact that the government is now able to get anonymized data for each patient, so that they can now take evidence-driven decisions. They're basing their plans and future decisions on what is currently happening, what is currently taking place in the country, the trends of the disease, or the eradication of this. So they have data, they can do more planning. Thank you.